Community Conversations, presented by the Steve Fund.
Hi, I'm Micah Wilson with the Steve Fund. Welcome to our webinar series, Community Conversations. This is designed to address the challenges communities of color are facing during this pandemic. Today's webinar is entitled, Communities of Color Face COVID-19, the Asian American and Pacific Islander Perspectives. Today, our moderator, Dr. Jeannie Manessi, is the National Steve Fund Advisor and an independent consultant. Our four panelists include Alyssa Hufano, American Psychological Association Predoctoral Fellow in Mental Health and Substance Abuse Services, Dr. Marcia Liu, a licensed counseling psychologist, Jay Wang, our Steve Fund Youth Advisory Board Chair, Miriam Mian, student at Hunter College. I hope everyone finds this discussion insightful and informative. Thank you so much for participating. And without further ado, Dr. Manessi.
Thank you, Micah. And I'd like to say welcome and aloha to everyone out there. I'm based in the island of Kauai, and I just hope everyone had a chance to see the beautiful bios of the rest of the panelists. And so today I'm so happy to be connected with all of you and be connected with our panelists who are from across the nation, from here in Kauai all across to New York. And I think, Jay, you're down there in Texas. Is that correct? And I think we've got Alyssa in California. So without further ado, I will go ahead and start these questions. We have really oriented ourselves at the Steve Fund to address the needs of college students of color. And so while our focus today is on college students and our answers will be geared in that direction, hopefully if parents or faculty or staff, anyone that is involved or cares about and works with students of color, whether they be Asian American, Pacific Islander, or of other ethnic communities, we hope these questions and answers will be informative for you. And we'll also have question and answer period at the end. So let me start out with Jay. And Jay, college and universities across the US have canceled in-person classes due to the coronavirus. And subsequently, most students can no longer be on their campuses. In what ways, if any, has this physical dislocation and subsequent sheltering in place impacted you and your family?
Yeah, thank you, Dr. Manessi. And so I kind of divvy this up between like pros and cons. So I think more of the negative aspects of sheltering in place, especially for my parents, is that they can't work. So we're dealing a lot with going through the huge process of like getting unemployment benefits and working through and navigating those systems. And then of course, for my parents who are more accustomed to, like working every day, like they've been doing for the past 20 years to support my brother and I, they're just at home feeling really antsy, and they're kind of stuck in a place where I'm trying to mitigate and kind of helping them like see that like, like it may take some time, but like we'll eventually go back to this like a normal setting, whatever that may be in the next like couple months. For me personally though, I'm having difficulty like registering for classes with the school just because everything is virtual right now, and I know that they're pretty swamped with everything, right? Especially with like summer term and fall terms coming together. So it's been really difficult in terms of trying to plan out that next step in terms of my education and navigating that system. In terms of more like positive aspects though, I've definitely had more bonding time with my parents, which is a gift in itself. Because as I mentioned, like, they've been working like countless hours at, like in the restaurant business to support my brother and I. And so it's nice to kind of have some time to chat a little bit, and discuss some really hard-hitting questions or issues that we've had in the past with each other. For example, I was able to have a conversation with my mom yesterday in terms of like my coming out and how that had like affected her, and like we had like a really nice like heart-to-heart conversation on like, you know, like it's a generational divide, like it's the 2020, it's like 2020, and so being LGBT like wasn't really a thing in the 90s, and so trying to give her space with that, and then vice versa. So that's been really nice. And then I know that I also mentioned that they're getting a little antsy, but I think they're also kind of enjoying a little bit time off to relax, um, even though this isn't necessarily their dream vacation since they can't go anywhere. But at least they're taking some time to like heal mentally and physically. So, yeah.
Jay, thank you for talking about how it has been for you, the pressures, as you mentioned, of not being able to work, the pressures of doing things virtual that you've never done before, but you also talked about the bonding time as a gift. And in my experience among Asian Pacific Islanders, family always takes a very central role in our lives. I wonder if just in a couple of minutes, anyone else would like to add anything cultural that they've encountered, you know, the concept of personal space. You mentioned generations can be different, privacy, and things like our respect for elders. You know, what does that do when we're all together? When we used to maybe be in separate places. Is anyone out there? Maybe you can raise your hand if you would like to mention this. Anybody?
I can go. I'm just going to add that so many Asian American families are living with not just one, but multiple generations in the house. And how we know that for so many Asian American families, there's a lot of conflict because of multiple acculturative processes that are happening. Exactly how Jay is saying, like the way that one parent grew up might be vastly different from the way that a kid is growing up here. And that tension is really coming front and center when you're locked in the same house together for 3 to X number of months. So I'm not surprised in terms of thinking, like, I think that this is a common experience for a lot of folks who are facing that closeness and trying to figure out how do we resolve those tensions or resolve those differences.
Thank you, Marcia. Anybody else out there want to share what's happened as a result of being dislocated by COVID? Okay, maybe we'll go on to the next question, and there may be some questions that the audience brings up and we can return to this later. So our next question goes to Jay as well. And Jay, according to the International Business Times, April 6th, there has been a rise in the number of anti-Asian hate crimes in the country after the outbreak of the coronavirus pandemic. During this time of COVID-19, in what ways have you seen or experienced negative anti-Asian aggression, stigma, racism, or xenophobia? And I might also throw in there the anti-immigration backlash that has been a real challenge.
Yeah, so this is a big question, right? So in terms of like my own personal experience, is just a lot of staring and glaring when I go out just to take some fresh air from people. I've also had instances where like people are like consistently like honking at me through their cars. I've also had this like weird interaction where like if I'm at an intersection with like a stop sign, I will see a car like park like 8 to 10 or like stop 8 to 10 feet away from the stop sign when I'm there. And I'm just like, okay, curious, but all right. Another personal experience that I've seen is yesterday I was at some parks with my mom, and we were wearing our face masks like we're supposed to out in the park. My mom hated it, but I kept nagging her to wear it. And this person on a bike with this horrendous like orange neon shirt was like staring at us, and then he was like aggressively like shaking his head at us, and I'm like, we're wearing masks, you're not, what's the issue here, right? But aside from that, there are also like more scary things that are being seen on the news, right? For example, I think a couple of weeks ago, I heard about a family being attacked in Midland, Texas, where like even the children were stabbed. And I'm just like, these are children. Like, I don't understand. Other things are what happened with Lululemon, I think like within the past week or two with their bat fried rice shirt that came out. Luckily they did like a PR thing and, you know, like kind of like denounced what ended up happening. But those are still things in terms of like racism that like affects other Asian Americans where they're like, okay, like this isn't our identity, like that isn't like part of us. In terms of xenophobia though, like I think there's kind of like a double front, right? Like there's xenophobia from like Americans and there's also xenophobia from Asian Americans as well. So when everything was happening, my parents were very like adamant about like us not going to Chinatown or going to Little Koreatown because they were scared of catching something from like these like immigrants or recently traveling people. And I'm not sure if this is like common with other minority groups, but I think it kind of fed into this whole idea, at least from what I've experienced with Asian Americans, where it's like established Asian Americans, recently immigrated Asian Americans, and newly coming in Asian Americans, that there's like a weird relationship slash hostility towards one another that I've seen sometimes. But that's a different topic. Other things is that I've noticed are restaurants are trying to play up in terms of like not being hostile to continue having patronage. And I think that also kind of, and like they're getting praised for it, which I kind of find a little weird that they're being praised for doing something that they need to do to survive. Because that also plays into the whole conversation of Asian Americans kind of conforming to like be more American, to seem less hostile, to kind of like fit in. But again, that's a different topic. On a more positive end though, I really appreciate a lot of both professional organizations and other like groups of minorities like coming together and denouncing a lot of these like hate crimes and acts of racism. And I like really do appreciate that like sense of like allyship and unity. And I hope that continues not only for like other Asian Americans, but also like as a sign of unity for like Black, Brown, and like other marginalized communities. So yeah, a lot to chew there.
Thank you, Jay. That was a wonderful answer, and I'm sure that there are many things that you've both touched on and many things we would need hours. But I think in a short way of summary, you know, for Asian American and Pacific Islanders, this coronavirus has impacted, you know, our sense of safety, our true sense of safety, our civil rights in terms of, you know, as Americans, we have, or we should have the freedom to move about without hostile and fears of aggression. And I thank you so much for talking about allies and other communities of color, because, you know, I think that communities of color, we have been impacted in disproportional ways, different for different communities, and yet the hardship and the fears and the challenges are there. But I'd like to just turn it over for a minute if any of our other three panelists have something they might want to add. Any personal experiences? I think two of you are in New York, which is very hotspot for what's been happening with the virus.
Yeah, I can share a little bit. I wanted to acknowledge that it doesn't have to even be an event that happens directly to you. You could read about it happening in the news, just like Jay was talking about reading about this event that happened elsewhere, and it still impacts your mental health on a day-to-day basis. That vicarious experience of knowing that somebody was targeted who looks like you in any way will then change your sense of safety, even if you live zillions of miles away walking through the street. that this is how we know, this is what we know about racial trauma. Miriam, you can also add in if you want. But I'm thinking about New York City. I definitely feel that sense of nervousness and a lot of self-consciousness. I think, like, I identify as Chinese American, and the first couple months that we were learning about COVID, I was like Googling like bat soup, and I was like, should I know this? I almost felt like there's some sense of responsibility to understand the breadth of knowledge that we still don't have, about every single part of this. And I think that really stems from this idea of us as a community being thought of as outsiders, that still we're not thought of as American. We owe some explanation in some way, even though I have no idea. There's no reason I should have to become like some environmental epidemiologist in some way. But I've noticed that as a stress for myself.
Thank you, Dr. Liu. Very important to talk about the trauma, the vicarious trauma, and the trauma of racism. I just wanted to maybe ask Alyssa, knowing that your background is as a Filipino American, and knowing that the fact is that many of our healthcare providers, particularly nurses, come from the Philippines. If you had anything to add, because for this population, immigration has been important. And now we're seeing all kinds of confusing and difficult messages, hostile messages about immigrants.
Mm-hmm. Thank you for that question. Yes, I can speak, on a personal note on that. My mother is an ICU charge nurse, and so she's really in the thick of it, having herself, who immigrated to the US in the 70s and 80s. And so she was there during the HIV/AIDS epidemic, and now here she is during COVID-19. And I think also something we have to note is that, a lot of the discrimination and racism against Asian Americans and also Pacific Islanders has been historically, there's a huge historical background to that. And so what we're experiencing now as far as COVID-19 is another iteration of that. And so I think, some things that I'm hearing from my own mom, who I speak to, and friends and family who are also healthcare workers in the hospitals, in the nursing homes, is really that pressure and that trauma of being expected to perform as someone who serves the other, and also the expectation to hold it together. And so I think comes the pressure of the cultural values of being there for one another and that collectivism, but then also kind of minimizing the struggles as well. I've also been noticing some folks who I know personally that have minimized the struggle on that. And so I think it brings up a lot of issues and also things to discuss as far as what folks are experiencing firsthand or even vicariously, like what we've been talking about over the last few minutes.
Well, thank you, Alyssa. And my heart goes out to you and your mother in terms of, what you're dealing with and the conflict and difficult emotions that arise with being a healthcare worker. I just want to add that, in thinking about this panel, and I think at the end we'll have some time for resources, but I saw this hashtag on social media, hashtag racism is a virus. And so that really struck a chord with me, that indeed, there are other ways besides health status that coronavirus has brought up in terms of, and magnified in terms of racism. I'd like to go on to Miriam. And Miriam, the next question that we have is the impact of the coronavirus and its financial fallout has created a unique and significant burden for many college students. In what ways has your current and future financial issues changed? And what resources are you using to cope?
Thank you, Dr. Manassi, and for everyone else that's shared so far. So for me at the moment, as of right now, my financial situation hasn't changed too much. before the semester started, I was lucky enough to pay off my tuition, and I live with my sister who is an essential worker, and I have been lucky enough to keep my job and work remote. But my biggest financial concern at the moment is for after I graduate, because this is my last semester as an undergraduate student. And I was planning to look for jobs and probably move out. And I still support myself by paying rent, and I support my family in my mom's home. So like COVID and all of this happening has created such a sense of uncertainty that prevents me from looking for jobs and looking for a way to support myself and my family. And I'm sure this is resonated by so many people, regardless of race and ethnicity. Especially in New York City, there's so many people I know right now that are suffering like this. Not knowing how the economy will continue to be affected, will continue to harm us, and the likeliness of getting a job is clearly impacted, and it's extremely stressful. And it feels really impossible to plan for the future. So I feel like there's this just overwhelmingly like overbearing amount of stress on all of us. And I'm definitely feeling it right now as a college student, because I'm also worried about my studies and my job and my family not too far away from me. But for resources, I feel like I have been doing all right. There's more resources that are showing to me every day. Like I just applied to some scholarships recently that are funded by my school and the government to support myself, support my rent, save that money, because other than that, without my job and my sister who just got sick the other day and had to take off from work, she didn't get sick pay, they didn't pay her. So it's been hard. But like you have to do what you have to do at this point. I don't know who else is feeling the same kind of pain as me at the moment.
Well, thank you, Miriam. The financial hardship cannot be underscored. You talk about, both the future, your worries, the current, needing and using resources. And we know in terms of economic justice, and there's been a lot of disparity from decades and decades that have impacted, the opportunities and the financial situations. I wonder if anyone else on the panel wants to add to that. Alyssa, I know you're changing jobs or moving from one status to another. Would you like to mention something as a graduate student?
Yeah, I think someone like myself who's a graduate student who's, moving on from academic coursework to now moving on to a full-time clinical internship at a college counseling center, there's a lot of unknowns. And I think something to not be underscored as well is just the personal financial burdens that have come, I've become aware of, during COVID-19, such as, I actually had to move during COVID-19 from, Central Coast, California to Orange County unexpectedly, I think due to some, personal family issues and health of family members, as well as kind of making that transition. So I really want to acknowledge the fact that many folks have already been in a transition, whether it's an academic one, a personal one, and then COVID-19 kind of really exacerbates or puts a lot of these transitional kind of, for me at least, have been anxieties under a microscope. And so I think for me, that's been very much a reality, moving from one place to another abruptly, and then to trying to figure out my finances and almost the uncertainty of not knowing what my potential internship year will look like, or this new phase in my personal and professional career. So I want to acknowledge that I am definitely going through that, and others may or may not have similar situations. And there's a lot of resources out there that we can get into in a little bit, but also knowing that it is not an uncommon experience.
Thank you, Alyssa and Miriam, for sharing how it is to be going through so many transitions. And, I, at the other stage of my career, can only imagine how the floor and ceiling have just like fallen away, maybe things you were expecting for months and years and all through your educational careers are now in this abyss of unknown. And so I want to move on to talk about resources, and maybe when we address this next question, even though it's geared toward mental health resources, Marcia, Dr. Liu, excuse me, can include a little bit more about other resources that people use, like for food banks, etc. Because I know that for some of the folk in my family, it is hard to access resources even when you need them because of the stigma, because of the lack of safety that you feel. And so I'll go on and ask the next question, and we'll go from there, all right? And audience, again, I hope that as you have questions, you will bring them up, and we will shortly be to our question and answer period. But for now, the next question for Dr. Liu is, research indicates that Asian and Pacific Islander students are often the groups of students that are most unlikely to utilize mental health services. What information can you share with others about mental health that might be helpful in this difficult time?
Thank you, Jeannie. I really appreciate this question. I think that it can't be underestimated how few API college students are using what we call like formal mental health treatment. They're the demographic that is least likely to seek out college mental health services. And oftentimes I think it feeds into the stereotype that this is a group that doesn't need these services, that they're generally doing really well. There's a lot of research that shows that there are many reasons why people aren't going, and it definitely is not because people just generally aren't stressed. The stigma that has really been brewing in the community that going to see a therapist, for example, or a counselor means that you are super crazy, that is something wrong with not just you, but your entire family line. It's so shameful for so many people, or this idea that it's so unpleasant, we shouldn't be talking about it. I think a lot of people in the community have bought into that idea, and a lot of students then also are thinking, I don't want to do this thing that sounds so culturally inappropriate and likely not constructive. How are they possibly going to know about me or my experiences, even if I did go? And I think for a lot of API college students too, they have really internalized this sense that their parents have struggled so much. They've sacrificed so much for them to have this opportunity. And the sense that their struggle right now, they're as a student, I'm having trouble in biology, or I feel really outcasted in my friend group, or I just don't feel confident in anything I do. That just doesn't seem to carry enough weight compared to my parents gave up everything, and this burden of they traveled so far to be here and they gave up so much for me. I need to kind of just muscle this out. This is just a sign of weakness if I can't get through this. What we know is that by the time API folks do get into treatment, usually their symptoms are more severe because they've been going on for longer. And it's usually harder to treat, it's harder to treat stomach cancer when it's in stage 4 than it is if you catch it in stage 1. It's not really preventative at that point. You're really dealing with long lasting, really intense symptoms by then because of all this stigma that's been going on for so long. I'd also want to highlight that API mental health needs are super diverse. We are such a nuanced, complex, somewhat aggregated community, and then also there's so much diversity within our communities. We're sort of taped together by legislative processes a lot of times. I think that there's a lot that's shared, but I think it's important really to highlight how different we're all struggling with different things because of different systemic policies that have impacted us disproportionately. I think also to think about as COVID-19 is happening, that so many of our families are really stressed in terms of income reasons. And this then falls out in so many different ways, whether that's I'm nervous about getting food on the table, or my parents are undocumented, or I am undocumented, and now we don't have as many opportunities for work, or with the immigration policy, what does this mean for my future? The anxieties are coming out in so many different ways, and it's all stuff that was there before, but COVID-19 just sort of rips out whatever kind of barrier of supportive safety net we might have thought we had and really shows, really shows all these systemic underpinnings that have been there for so long. So in terms of thinking about how to support APIs, I was thinking as administrators, as instructors, as teachers and members of the higher ed community, I wonder if there are ways to first absolutely acknowledge that this is a collective trauma that we are all going through. And I think for a lot of students, it's been particularly meaningful when people take off the hat of that hierarchy of like, well, I'm your professor and you're the student, and so we speak to each other in this way. I think that there's been something really refreshing about professors and administrators and people acknowledging, I am also struggling. This is really, really hard. To try and create this personalized connection, I think has been so important for people, because it's acknowledging, that this isn't normal. And especially since all of our interactions are over Zoom, I think it's even more important to try and create some kind of connectedness. So I teach a class at Hunter, I notice myself sort of leaking with more personal information as I'm talking with them, with my students, trying to really connect with them and make sure that I'm still valuing them as an individual. I think also naming the race-related stress too as a absolutely valid mental health stressor is really important. And in doing so, I think we have this opportunity to invite in more API stories into the forefront so that we can hear about API stories as being, they're having an American experience right now. I was thinking it's like sort of a way to combat immediately that sense of xenophobia that, I'm an outsider and not included. Actually, you're an insider and we need to hear about your story. I think it's so important to validate these identities. And then for students, there are a number of ways. I know that there are lots of websites that have talked about caring for yourself during this time. For me, I think it's thinking about identifying who in your life you do feel connected with. Thinking about, are there peers, are there friends, who's your community? And how can I connect with them, even if it's remotely, in ways that I'm prioritizing. I think for a lot of students, they're living with their parents and their parents might only see them in one particular sense. And losing a social community for queer APIs, for other APIs who feel so different from the way that they are at home, maintaining a connection to those people in their life who they feel really see all of their parts is so important right now. So I know that that's more challenging now than ever, but finding a way to prioritize those particular relationships and cutting out, no need to be on every single chat, on every single Zoom with every single person right now. You're just trying to get through something that you've never been through before, that none of us have ever been through before. So just giving yourself a break on that, I think, is also important.
Thank you, Dr. Liu. There's a lot of both issues and tips to unpack, and I saw among the panel a lot of heads nodding, and I'm sure when we get to the questions, there will be time for others to jump in. But just so that we can get through the questions, I'd like to go on to Alyssa and our next question. And this is especially a shout out for our students on the line, but of course, if you work with students, this can be helpful. So Alyssa, there are longstanding academic tips such as time management, class attendance, study buddies, and tutoring that have demonstrated to help achieve academic success. With all the disruption in class these days and the different ways class is being delivered, can you share either an issue or a tip that might be relevant to our audience?
Sure. I mean, we can spend all day on any of these questions, and then of course this one included. And so, before I get into responding to this question, because there's, I think, a couple ways I can respond to it, I saw this really, the internet and social media content is like, rapidly spinning out all these memes and things of that sort. But one Twitter and one tweet caught my eye last week, and it was a great way of paraphrasing and reminding us of kind of the current state of reality we're in right now. And this person had nicely said, you're not working from home, you are at your home during a crisis trying to work. And I thought that was a great way of, at least for myself, I'm a graduate student working on my dissertation, living with my partner, and I had to take a step back. I noticed for myself of like, I am putting all the pressure on myself to perform in the way that I, think I should be doing, pre-COVID. And now I'm trying to, you know, give myself a space to kind of work the same way I was before. And that just is impossible. And it's really hard to do that. You know, and a lot of, you know, with the research that shows of, you know, especially being in, you know, a confined space with, you know, some of us are privileged and lucky enough to have, you know, a window or a light coming through. And so we think about the way that, you know, space really impacts that. I think in terms of the disruption of, you know, for many of the students, college or otherwise, and the disruption in classes, I think, you know, if I kind of put that cultural hat or perspective on for the AAPI community, it reminds me of the model minority myth and performing in that way. And also the complexity of, you know, many of us are living in intergenerational families, or maybe some situations that at times feel a little less safe for us. And so I think comes up the issue of, you know, one, I'm expected to perform in the same way that maybe I myself feel like I need to, or others may put on me. And then two, also try to tend to my own needs. And that can be many times very much conflicting. And so I think with that being said, you know, these are my experiences. And also at the same time, I think it's a really difficult, but I think necessary time to really think about, well, what do I need in relation to others as well? And also, you know, it may be having those honest conversations with friends and those who you find safe. It may also be having those honest conversations with a boss or a professor privately, you know, obviously in the way that you feel comfortable disclosing in, that sometimes it might be hard to concentrate on a certain task. Or it also might be finding creative ways outside the way in which you normally work, quote unquote. So that might be taking a step outside if it may be safe, or also paying attention to those emotional adjustments and physical adjustments that you're experiencing. I know for myself, I can sometimes kind of just try to get through a task, and all of a sudden I'm like with a headache after 3 Zoom meetings or 3 Zoom classes. And so it's also a difficult time for myself, and I can imagine for others to kind of really, there's nowhere to run as far as hiding those kind of emotions and physical adjustments that you're really sitting with it now. So just acknowledging that, and I think finding, again, I think I hear this common theme of these spaces and people directly that can really connect you to what you may need in that moment.
Thank you, Alyssa. So I'm hearing you talk about maybe self-care is number one, and from there, all the rest, we have to figure out what we need in this difficult time in order to link that to what we need to do sort of behaviorally in terms of academics. But you highlighted relationship. Mm-hmm. And I think you also highlighted that how we are relating is changing. It's in flux, and it has maybe been something that has been one of the biggest changes. So with that, I want to ask this last question to you, Alyssa, and hope is a feeling. So in these difficult times, hope is a feeling that may often feel elusive, but what actions do you see or engage in to generate hope for yourself and others? And I know that you're a psychologist in training, going into internships. So I think both as a student and a practitioner, you are always probably thinking about hope.
Sure, yeah. Hope is something I think that is very easy to, especially in these times, is something to kind of put by the wayside and not be talked about. And, you know, first of all, I wanted to acknowledge what we're doing right now. I think even in this moment of, you know, I see over 100 of us gathering together during this time and making space and connecting with each other in this way, for me, is a form of hope, because one, it acknowledges that this matters, and this community matters with the Asian American and Pacific Islander community. So that in and of itself is already a small win in my eyes. So for that, you know, it's very invaluable to me to have a space like this where we can connect and talk about these experiences and in a way validate that this is real as well. So many of our times in our own families or in our own circles that isn't talked about. And a lot of that comes in terms of the strength and having to push through. But I think slowing down and having this is a moment of hope for me. I think in and of itself, you know, many folks are having a hard time grabbing onto that hope. I think for myself, you know, in the middle of all of this, I'm actually planning a wedding. I'm supposed to get married in July. And so something that reminds me of is celebrating the things that you already should be celebrating, whether that's, I know many folks have been, you know, really upset and sad and frustrated over the fact that they can't have any graduations anymore, or celebrating birthdays and a lot of these milestones in life that we have. And I think it's also giving yourself permission to have that, to celebrate that. And it's not to say that that's minimizing any of the fear and, you know, the sadness and the grief that is happening concurrently. We can experience both at the same time. As odd as that feels, I think, you know, even for myself on a personal note of getting married in July, I think it's something that we, particular in the AAPI community, can sometimes struggle with, is that it's okay to have these moments of joy too, as hard as that is sometimes to hear. So for me, it's been, you know, celebrating the milestones of, having a virtual wedding shower or even getting on certain apps to connect and celebrate people as they're defending their thesis or dissertation. And I think it's also checking in on those who may be silent right now, as far as not having much of a presence, reaching out to you. I think that can be forgotten about too. So I think in terms of having hope and generating hope, I think there's a lot of avenues, but it really starts with us, and it starts on with yourself.
Thank you, Alyssa. Thank you so much. You bring up important aspects of dealing with hope, generating hope through celebration. You also touched on the strength we need, the courage we need. They all go together along with hope. And I want to point out one thing that really struck me is you're talking about leaning into the collective, you know, to celebrate, to find that hope. And I think that is something that many of us remember or have lifelong used our collective. And in many ways, now more than ever, it's an avenue of comfort, safety, hope, peace, strength. So thank you again for that answer. I did want to make sure that the audience's questions are addressed. So now I think I'm going to turn it over to the Steve Fund, and I will help facilitate our panelists, and I can see you all. So if you just want to kind of raise your hand or take yourself off the mic, we'll try and work through this.
Great, I'll jump right in. From Jenny Wang, we have a question asking, what advice do you have for young adults and college students who are suddenly living with intergenerational families again and experiencing conflicts due to differences in views on boundaries, independence, privacy, and so on?
So I see a lot of heads nodding. Maybe I'm going to start with Dr. Liu here.
Yeah, sure. Thank you for your question, Jenny. I think that first, it's a really difficult situation. I mean, I think we all know this, but just acknowledging many of our students don't have their own room. You know, they're sharing a bedroom with somebody. And this sense of my family is making me even more stressed out, and I don't have any space to even create a boundary around myself. I work with Asian American students over at Hunter College as part of a grant funded program. And we made this video about how to take care of yourself during this time. And one of the things I said in it was like, try to find 5 minutes, whether you have to go to the bathroom, just like in the beginning of the day or at the end of the day where nobody's around, 5 minutes to yourself in the bathroom, wherever it has to be, just to do some breathing or just to do some journaling, just to yourself. Or is it leaving the house and taking a walk with a mask somewhere? I know that it's really scary to do this during these times. But I think trying to connect with the parts that you feel like you're not being seen from your parents, from your family, whoever, is it that they only see you, they tend to think of you as, you know, their daughter who is in charge of these things, but you also are a wonderful friend, and you are also really into a particular type of anime. Well, write about that. How do you connect with that part of yourself to feel like you're still nourishing yourself? And in some ways, you're kind of building a boundary, even though you can't really see it physically, but you're internally building a boundary of, this is for me. This is just for me. This is where I can go to just write about the thing that I really love and enjoy. Is it that you're really into this particular type of movie? Is it that you're really into some other hobby? It's like, or it could be with like a particular friend, like carving out space where you can feel connected to that internal part of yourself, I know it's a really difficult thing, and it's much easier when you have more space. And we know that all of us are really trying to keep it together, feeling really constricted, especially with more people. It can feel really intrusive. So I guess I both wanted to acknowledge, like, of course, that this is really, really difficult for this community in particular, and trying to find creative ways to feel connected where you're building those internal boundaries yourself, I think could be one strategy. A lot of folks will do meditation for those 5 minutes, whether it's in the bathroom or elsewhere, where they're doing some deep breathing and they're just trying to maintain a sense of presence and space. It's essentially you creating space for yourself, which is physically a miracle that you're doing this. So just to acknowledge, I know that this is hard. It's hard to find really satisfying answers for it, but I do believe in it, that it can be done.
Thank you. The next question: what would you recommend for helping AAPI cope with the dual pressures of racial trauma and health risk at this time?
Alyssa, I saw your head nod. Do you want to take a shot at this?
Sure. Can you repeat the question, please?
Yes. What would you recommend for helping AAPI cope with the dual pressure of racial trauma and health risk at this time?
Yeah, I think one thing that is really important is understand the types of things you are ingesting as far as media. And so, you know, I think there's that fine line between, you know, trying to get the information and staying updated with things, and also feeling bombarded of hearing a lot of terrible things and negative things too that can really impact you. And then, you know, that's on one hand. On the other hand, you know, these real direct experiences folks have been, you know, talking about or experiencing as far as, you know, discrimination and racist, you know, comments and things of that sort, whether directly or indirectly. I think it's something that is really difficult to really take care of on your own or feel like you can handle. And so I always bring us back to this idea of connection that we've been talking about this past hour, of who is it there that you feel safe with and that can validate these real experiences happening. And at the same time, I also want to acknowledge we haven't talked about this as much, but, you know, many of us or our family and friends do have medical conditions that are of concern of safety. So there is that valid fear, and I think risk and safety, that is something that is important to note. And so at the same time, you know, with that being said, you know, safety is important, and at the same time, finding those creative ways where we can engage in that healing, and whether that is in connection to self or self-care in certain ways.
Thank you, Alyssa. I think we have a few more questions.
Yes. So Alton Carswell says, as an API therapist, I find that connecting to students in the ethnic and gender groups via information sessions about AAPI communities and mental health has bridged myths somewhat. But what other things are out there? I would like to connect with others on this.
I'm going to turn the mic over to Jay. Jay, is that a question that is in your mind? Is something you want to respond to?
I'm gonna need to pause real quick and like reread the question.
Yeah, no problem. As an API therapist, I find that connecting to students in the ethnic and gender groups via informational sessions about AAPI communities and mental health has bridged myths somewhat. But what other things are out there? I guess to help bridge those myths.
Yeah, so I think one of the things that happened when I was an undergraduate as like a peer educator for the Counseling and Mental Health Center is that we had folks go to like the cultural centers and kind of share their own personal like stories and interactions with their mental health. There have also been instances where I find that like Twitter has been extremely helpful because a lot of people share their own experiences in terms of juggling their various identities and how they deal with it. And I think, but yeah, I don't really have much to add to that one. Sorry.
You mind
Thank
if
you,
I
Jay.
add something?
Go ahead. Go ahead, Alyssa.
I think also something that we need to remember and note is that we, when folks identify as API, there's an assumption that we may know certain resources or tips or ways to help when, folks are on a whole spectrum of how they identify as API, whether folks feel very culturally tied or not so much. And so I think putting it back on the laps of others, meaning, asking forthright, what has helped you essentially in this situation, and also finding ways maybe even outside mental health, for some folks in healing that is creatively in the arts, maybe it's in the sciences, and I think when we tend to box ourselves in as far as healing and ways of connecting, I think that might be something that we could miss. And so I think also bridging outside the fact that, we all heal in different ways, and sometimes maybe connecting with ethnic groups specifically in our own culture may or may not be helpful. So it's kind of that, like, it depends. But I think I also want to acknowledge that too, that we all have different ways of responding, and asking directly might be also really helpful of what has helped them during trying times.
Thank you, Alyssa. And we are getting close to wrapping up, but I think we have 5 minutes or so. So Micah, is there a couple more questions out there?
So what I'll do is there's a comment out there that I'll share, and then I'll ask the last question. So
Okay.
Dr. Carlton Green said that he listened to a great TEDx talk on comment of you need to be grateful phenomenon today. He highly recommends, especially high toxic positivity leads to more suffering, and it's by Mahmoud Kadir. So he thought that might be helpful in reference to some of the things we've been talking about. So our last question, I am part of the AAPI community, and during these times, I have family members and friends who will occasionally make racist comments like, the Chinese people are responsible, or it's no surprise COVID is spreading quickly amongst the Black community. Do you have any advice to tackle these types of comments, especially when they are against others in the AAPI community and when it is affecting your own mental health?
Miriam, we haven't heard from you for a while. Is there anything that you want to start out?
I feel like it's really important to acknowledge what Dr. Liu said earlier, how you shouldn't feel responsible to educate other people and to hold that kind of responsibility or duty to protect an entire like ethnicity and racial background of people. It's unfair to you, and I feel like it's important to address that first before tackling something so huge as addressing somebody who's making racist or xenophobic comments. It's important to first say this is not your responsibility to represent an entire community. That's like my first comment to put out there.
Okay, so you're talking about, recognizing to carry the burden of educating everyone at such a difficult time and such a complex issue is something we can give ourselves permission to say, hey, this isn't just on me, this is on us, right? This is on us when we are ready. And is there anyone else out there that would like to add?
I can add a little. I feel like I'm so glad for this question. There is so much intertoxicity within our community, within the API community. We have so much beef with everybody. And I think like some of that is like ethnically, that we've had different histories amongst different ethnic communities. Racially, clearly we've been really squared against Black and Brown communities as a way to really continue this white supremacy. You know, it really is a wonderful distraction. And I think a lot of API youth are in this really funky position of having been socialized in America, learning a lot about how the mono-minority myth works as a tool for anti-Blackness. But their parents have not had necessarily that same experience of learning it that way. And this tension of like, so how do I have these conversations? I mean, Jay, you started us out in talking about your own coming out experience and how that was in using this COVID space to almost get closer with your mom and working through that tension. I think like this is gonna, like knowing that this is a process. This is gonna be a process. This is number zillion on your list of bicultural tensions that you're working through with your family. This is just another thing. You've actually already been building these skills and having these conversations your entire life. Finding ways to introduce them to probably material and history that they might not have been exposed to before is a lot of work. And give yourself like the time and space. I think it's so important that you're taking on that priority in terms of having that conversation. But know that it's going to take time to you're changing an entire perspective. And though I think it's really wonderful that you're taking that responsibility on, like just know that it's going to be complex and that you should get support. Many of us have been in this position before, and trying to have these conversations and reaching out to get allies within our API community and how to have those conversations, I think can be really important for this time.
And I want to add real quick, sorry.
Go ahead, Jay.
I think it's like what was mentioned before, but Dr. Liu and Mariam is that this is like a huge task sometimes, because this can be years and years of like bias and prejudice and racism that exists, right? And just in my experience, like there's also that kind of dynamic in power, right? In terms of like older generation, respecting your elders, but not crossing that line as someone who's younger. And I found that instead of tackling it as a whole and like really going into like this in-depth conversation about like sociological aspects of like why racism is bad and it can also help to take little steps in terms of like reframing like what your parents are like saying and be like, kind of like nudge them and be like, why do you think that? Like, why is that something that you're saying? Like, does that affect everyone? Or is it just because that's something you heard and like, you're now stereotyping and then as a result, you're buying into this whole system? But that's something like that.
So Jay, thank you so much. And to all the panelists today, I want to thank you as well as thank the audience for those great questions. Shout out to Carlton Green and others who have sent informative resources that might be helpful. And I want to also thank the Steve Fund. So with that, I will turn it over to Micah from the Steve Fund to see if there's any closing remarks.
Thank you so much. And you guys were absolutely wonderful. I learned a lot. It was informative and insightful for me. So thank you very much. So we will have this recorded and it will be available on our website in a couple of days. And I want to let everyone know that on May 7th, we're going to have another webinar, and it's for mental health providers supporting clients of color, self-care, community care. So we really know we can't do it without you, but we want you to take care of yourself. So this is really the focus of the webinar on May 7th. And when you go to the stevefund.org, there will be a registration available for that now. And thank you all. Thank our participants and audience. And we hope that we will, I guess, have you on again on May 7th.
Bye-bye.
Thank you so much.
Thank you.
And thank you
Take
very
care.
much.
Wow.
Thank you.